Welcome back to Washington Watch. I'm Joseph Backholm, sitting in for Tony today. Is monkeypox here to stay? That's the question epidemiologists and public health officials are forced to consider as the CDC confirmed this week the virus has hit all 50 states. This comes amid increasing concerns the Biden administration has missed its window to prevent a full-scale outbreak. So far, the virus has been overwhelmingly limited to the group currently described as, quote, men who have sex with men. Has the continued spread increased its chances of infecting everyone else? How concerned should we be for our own health? Joining me now to discuss this is Dr. Amesh Adalja, senior scholar at Johns Hopkins Center for Health Security. Dr. Adalja, welcome to Washington Watch.
Thanks for having me.
Good to have you. Now, first, tell us what monkeypox is. We've heard about it, but most of us are pretty unfamiliar.
Monkeypox is a virus that is very closely related to smallpox, which was a virus that was a scourge of humankind for centuries and was eradicated from the planet. Monkeypox is something that was discovered in the 1950s. It was discovered in monkeys, although monkeys are not really part of the life cycle of this virus. And the first human cases started to occur in the 1970s. And it really has been confined to about 6 countries or so in Central and Western Africa. And we would occasionally get importations into other countries. The disease is characterized by a fever and a rash. So people have a very characteristic rash with monkeypox. It isn't something that has a very high fatality rate, and it's not very contagious outside of close contact or contact with whatever animal reservoir this virus resides in. And this is something that we have vaccines that can be used. We've got antivirals. We have tests. It's just been difficult to deploy them effectively and competently in this outbreak, which has spread wider and farther than it ever has before.
And let's talk a bit about that. You mentioned there that it's been around for decades for sure, but the spread that we're seeing globally now is wider than what we've seen. It seems to have been controlled in the past. What is it that led to the outbreak that we are now seeing?
The best estimate for what happened is that this virus found itself in a social sexual network of men who have sex with men, and that's allowed the virus to take advantage of close contact between individuals to spread. It's not that the virus got a new capacity. It's just that it found itself in a hospitable environment to spread. And that's what's happened. And you have to recall that in the early days of this outbreak, many of the cases were misdiagnosed or there was delayed diagnosis because the virus was masquerading as a sexually transmitted infection. And that allowed the virus to get a head start. And we've been playing catch up ever since. So it's really the social network, the network effects, as well as the fact that it was being misdiagnosed as a sexually transmitted infection.
And explain that difference. You say it's been misdiagnosed as a sexually transmitted infection. If that is not what it is, yet is predominant within the category of men who have sex with men, how would you categorize it?
So when I say misdiagnosed as a sexually transmitted infection, what I mean is that in the past, monkeypox has usually been a travel-related infection. It's not something that presented with lesions in the genital region. So if you're a doctor working in a sexually transmitted infection, monkeypox is not going to be on your radar. You're going to think about things like herpes or syphilis or chancroid or chlamydia or gonorrhea long before you would ever think of monkeypox. So many individuals got a diagnosis of a sexually transmitted infection, a traditional sexually transmitted infection, and did not get treatment or diagnosis for monkeypox, which then allowed the virus to spread. We don't know if this is sexually transmitted or just sexually associated. Obviously, when people have sexual relations with each other, there is close contact. So this clearly is sexually associated. There is some evidence that it might be transmitting sexually. They found the virus in bodily fluids, but that science has yet to been complete. But the thing is that because it was presenting in a way that people had never seen it present before, that led to a delay in recognizing that the problem existed and how big the problem was. And we've been playing catch up ever since because of those early diagnoses that were missed and allowed the virus to spread.
How much does the fact that this is occurring on the heels of COVID-19, how much has that affected the global and national response to monkeypox?
Many of us thought that we would be able to control monkeypox much easier than has been the case because this is a disease that we've known about for decades, for which we have off-the-shelf vaccines, antivirals, tests, This is not a very contagious disease. It requires close contact. It's not transmissible during its incubation period, as far as we know. So this should have been something that was easy to quash. And I think the fact that this is happening on the heels of COVID-19, where we saw systemic failures in containment, that really is not reassuring. It really makes me think that we need a wholesale reevaluation of how we respond to infectious disease emergencies, because clearly we're not up to the task. This should have been something that was very easy. One other aspect of it is that we know that our public health agencies are overworked, they're understaffed and under-resourced, and they're burned out because of COVID-19. And these are the same people who have to now organize testing, vaccine clinics, and a lot of public information campaigns for monkeypox at the same time that they're still responding to COVID-19 and still feeling the after effects of that enormous response over the past 2 years.
Dr. Adalja, in about 30 seconds, in your judgment, how concerned should the average American be about this?
There is a tendency post-COVID-19 to look at every infectious disease emergency through the lens of COVID-19. That would be wrong. Each infectious disease has its own transmission characteristics, its own level of contagiousness. And monkeypox is something that is not contagious in the way that a respiratory virus is contagious. This is something we have tools that we can stop it with. The goal is really just to get those tools to be deployed competently without the bureaucracy and red tape that has hampered this response. I think this is something that can be contained, but only if the government acts as it needs to be, responsive to the people on the ground that are actually combating this.
Dr. Amesh Adalja, thanks so much for your time.
Thanks for having me.